Hi, it's Brian Newman. We're with the Roundtable meeting. This is our second one, and today we're thrilled to have Carrie Smalley. She's the owner of Stellar Care Clinic. So, hi, Carrie. If you want to start, this would be great.
All right. Hi, Brian. Again, thanks for having me. And Carrie Smalley, nurse practitioner. So I've been in healthcare for 30 years. I'm certified as both a family nurse practitioner and an emergency nurse practitioner, as well as I'm a certified fast metabolism coach. I've studied through the A4M, which is the American Academy of Anti-Aging for hormone replacement therapy. And today I wanted to talk about all about hormones, everything and everything you ever wanted to know about hormones, specifically bioidentical hormone replacement. That's all I suggest anybody ever does. But first, we'll kind of explain what bioidentical hormones are. So essentially, bioidentical hormones involves the use of hormones that are chemically identical to the ones that produced by our own body. So these are used to treat symptoms of hormonal balance in both men and women, especially as they age. So the goal of this therapy is to decrease all the symptoms associated with hormone production that decreases as we age, such as hot flashes, night sweats, mood swings, memory loss, and other health issues. And so one of the biggest differences between bioidentical hormones and synthetic hormones, which these are often like the Premarin and stuff that we see prescribed in primary care, it's in the molecular structure. So bioidentical hormones are exactly the same in structure and function as what our body produces. And they're usually produced from plant sources such as soybeans and yams. And they're crafted in a lab to make sure that each one is identically molecularly similar to our body. This is not the case with synthetic hormones. These are often derived from like the urine of pregnant horses and other synthetic substances, and they're not identical. And this can lead to decreased efficacy as well as side effects. So, and because bioidentical hormones mimic our body's hormones, they're a lot more easily metabolized by our body, and they can which this can increase the efficacy as well as the safety. And these hormones are essentially customized to each specific person and what their hormonal needs are based on a comprehensive evaluation. So, understanding a little bit of roles of hormones in the body. So, hormones essentially impact every single thing. They're essentially messengers that send out messages to our body telling it to do something. So, roles that hormones play in our body, they regulate growth and development. From when we're in utero, they're crucial at the earliest onset for the development of growth, influencing everything from prenatal development, childhood growth, adolescence, and they even affect how tall we are, our muscle growth. Things like thyroid hormones, they're essential for our overall development, our metabolism, specifically the thyroid that I mentioned. This can affect how we metabolize things, our energy, our body temperature, and everything in between. Hormones are also very important for management of reproductive health. So they essentially regulate all aspects of our hormone production and reproduction, including menstrual cycles in women, sperm production in men, sexual health for both men and women, and estrogen and progesterone govern the menstrual cycles and pregnancy, while testosterone is more for the sperm production in men. Hormones maintain homeostasis. So every single day as we live and breathe, hormones are working in our body just to keep everything kind of going even keel. We don't even think about it. It just happens. But when things started getting out of whack is when we start noticing different symptoms and things associated with this. Specifically, even things like insulin in our body is actually a hormone. This helps us with our glucose control. So when this gets out of whack, we develop diabetes. So cortisol helps us manage our stress. And when we're under too much stress, we can be depleted and we can be in what we call adrenal fatigue. So this can really just affect our overall body and how we're feeling. Hormones influence mood and behavior. So certain hormones have profound effect on our how we feel, how we behave. Like serotonin and dopamine can affect mood, anxiety, happiness, while hormones like cortisol affect our stress levels. So hormones can affect our physical health. So hormonal imbalance as we age can be linked to like thyroid hormones. When people get hypothyroid, this can cause weight gain, fatigue, constipation, dry skin. Excess cortisol can lead to Cushing's disease, or the conversely, too little can lead to adrenal fatigue. It can affect reproductive health in women. They can have irregular menstrual cycles. They can develop polycystic ovarian disease. Men can have low testosterone. This can have decreased libido, fatigue, reduced fertility, and everything from erectile dysfunction. Again, the mental health impact, hormones are strongly linked to mental health conditions such as depression, anxiety, and mood swings. This is sadly where a lot of people present in primary care. They're having all these symptoms and they say, oh, you sound depressed. Let's put you on some Prozac or Zoloft. And they don't really go far enough to really dive in to see what's really going on with people. And unfortunately, hormonal imbalance can have a huge increased risk of chronic disease, like developing things like osteoporosis, diabetes, cardiovascular disease, metabolic dysfunction. And low estrogen levels in women can really have an increased risk of osteoporosis, especially in the postmenopausal state. So essentially, hormones impact our overall vitality and our quality of life. So specifically, we're going to go into each of the specific hormones so that this kind of explains what each one kind of does in our body a little bit. So the first one we're going to start with is estrogen. So estrogen, the roles in the body for female, of course, is the female reproductive system. It's essential for the development and function of the reproductive organs, our menstrual cycle, maintaining pregnancy. In both men and women, it can help support cardiovascular health. This is done by influencing cholesterol levels, our blood vessel functions. Super important for bone health. So it plays a big factor in bone density and strengthening to help regulate turnover of our bone tissue so that our bones don't get thin. That's when you hear about people, osteoporosis is, when people fall and they're just breaking bones left and right. Um, it affects mood and cognition. It plays a huge role in brain function, affecting mood, our cognitive abilities, and this can change over the lifespan, which is a lot why we see when people start going through either menopause or andropause for men or menopause for women. This can start to happen. So imbalances in women can lead to symptoms like hot flashes, night sweats, vaginal dryness, osteoporosis, and increased risk of heart disease, especially postmenopausal. On the other side of the coin, excess estrogen can be linked to weight gain, menstrual irregularities, fibrocystic breasts, and an increased risk of breast cancer. So very common that women can kind of get estrogen, what they call estrogen dominant. Men can also get increased estrogen levels. And we see this more and more with all these estrogens, the phytoestrogens that we get exposed to in our environment. So men start developing breasts. They kind of get, we call them, moobs, man boobs, erectile dysfunction, infertility, mood swings. It just plays a huge amount of factors in the body. The next big hormone is progesterone. So progesterone also plays many roles inside the bodies. Again, for women, it supports a menstrual cycle and pregnancy. Sometimes for women, when they're having repeat miscarriages, they actually have to support them with progesterone because they're not producing enough, and therefore they can't maintain their pregnancies. It definitely influences mood and cognitive function. So especially in my women, this is the only one that I like to do orally for women because it helps with insomnia. When they're just like, oh my gosh, I'm going into menopause, perimenopause, I can't sleep, this is awful. Progesterone at night is like candy. So it definitely plays a huge factor. It promotes bone health. So it's involved in bone building processes, helping to maintain bone density along with the estrogen. So low levels can definitely lead to irregular menstrual cycles, miscarriages, menopausal symptoms. High levels can obviously do the opposite, mood swings, bloating, changes in libido and weight. And in men, progesterone plays a really important role in the development of sperm and overall sexual health. The next one is testosterone, which is known one of the most well-known hormones, especially in men. And while it's commonly associated with male health, testosterone also plays a huge, crucial role in women. So again, it's very important for muscle and bone health. It supports metabolic health and physical functionality. So essentially, it enhances muscle growth. This is why you hear about men abusing testosterone because they're trying to do anabolic steroids to build up the muscle. But it's also what you see when people are getting low on testosterone and men are like, wow, I can't even keep my muscle on. I just look like I'm withering away. And the same with women. Women do have testosterone. We just have lower levels of it. And it's important for the bone mineralization in our bones. So it plays a lot of things. And it's very important in sexual health. Obviously, for men, it's important in the male reproductive tissues and maintaining bone and muscle mass, and even stimulates hair growth in men when they're going through puberty and so forth. But for women, it's also very important for ovarian function, bone strength, and most importantly for sexual desire in both of the sexes. So for men, low testosterone can lead to several issues, everything from fatigued, increased body fat, reduced libido, erectile dysfunction, and then you go on to the physiological, psychological effects, which is everything from depression, decreased drive. They just don't feel like doing anything. They're not motivated, and just they have an overall decreased quality of life. And in women, it's even though it's not often discussed, it's still significant because they can have reduced sexual desire, lower energy, weaker muscles, and that again affects their overall health. But the broader implications and everything can be the long-term effects that we see. So the increased risk of diseases like osteoporosis, metabolic syndrome, and the mental health. I've literally had a patient that was a male on testosterone. I mean, their job was at risk, their marriage was at risk. They had just lost all interest in anything, and it literally changed their life. It didn't just make them feel better; it saved everything. And again, it's sadly something where people go in and they present to their primary cares, they discuss these symptoms, and they're often thrown on antidepressants. So that's kind of a sad thing. The last of all is our DHEA. So DHEA is what I call pretty much mother hormone. So it's our main hormone that essentially is a precursor to all of our other hormones. And when this gets low, it can fundamentally affect every single other hormone in there because it is a precursor to all the other hormones. It's produced by our adrenal glands, and it's fundamentally important for a wide range of bodily functions because it is kind of like the mother hormone. So it also can play a huge role in immune function because it's been shown to enhance the response and provide protection against various diseases by modulating the function of our white blood cells. So it can keep us from getting sick, from especially like during this flu season and so forth. Very much linked to energy and vitality. It helps us maintain our energy, our overall vitality, because it is the precursor to all of the other hormones and stuff. So when you have the low DHEA, it can lead to symptoms like fatigue, depression, susceptibility to illnesses like the common colds, flus, decreased physical strength. And because it decreases all the rest of the other sex hormones, all the things that kind of go along with that. Conversely, you can get a little high on DHEA. It's kind of like a complicated system, but everybody's different. Sometimes we like to back convert or we like to be too high. Our body always wants to maintain homeostasis. So it's going to do everything it can to pull it from your cholesterol, everything it can to keep your levels where it's at. So sometimes this can really cause one level to go way up and one to go down. So if you're really high on DHEA, you can actually get things like excess androgen symptoms, which is like acne. You're like, why is this hair growing where it's not supposed to grow? Irregular menstrual cycles in women, and all these kind of things. But a lot of times if a patient's like low on this hormone, we kind of correct this first because it is a precursor to making all your other hormones. So sometimes if you just mildly correct this, then everything kind of falls into place. So one of the things to go into next is talking about how we implement all this. So essentially you come in for what we call a comprehensive assessment, which includes hormone testing. This can be done through blood, urine, saliva testing. Blood is the most common, just especially because it's more covered by insurance. I'm 100% cash-based business because hormone replacement therapy is not something typically covered by insurance. They will somewhat cover the synthetic hormones, which I never recommend. They're very increased risk for cancer for those. You got to make sure to have symptom tracking. It's not just about a lab value. You got to go by what the patient's saying. So really what their symptoms are, their lifestyle, and this way we can kind of develop a whole individualized formulation specifically to that patient. So we use compounding pharmacies, and you can actually compound specifically what the patient needs. If it was just testosterone, you can do that. If it was just estrogen, we don't ever do estrogen without progesterone. That's because we have to protect the uterus and so forth. But we compound these specifically to what the patient needs. And then obviously follow up for regular adjustments and so forth. Very, very important. You can administer them through pills, capsules, topical creams, subcutaneous pellets, and injections and patches. I'm not a huge fan of the pellets. I obviously don't do them because that requires an in-person visit. The only reason I'm not a big proponent of it is because it can really overshoot the patient. It's convenient because you can do it and not have to worry about it for 3 to 6 months. But I had a patient that they put a testosterone pellet in a woman, telling them that they would back convert to estrogen. It was a female who had a male testosterone level of 800. She was miserable, and there's no one doing it. It's been put in her body. So the only thing you could do was to give her some blockers to kind of reverse it until her body absorbed that. Now, conversely, if a patient was really dialed in on a level and they've been the same, they've been good, then pellets can be beneficial because it's put it in there and forget about it for 3 to 6 months. Testosterone, typically more done by injection, can be topical. Progesterone more in the pills, but typically the creams and so forth that people apply daily. We also have to, highlight the lifestyle considerations, because obviously if somebody is definitely afraid of needles, they're not going to do injections. So you kind of have to go, individual for what's with that patient. But the benefits of hormone replacement therapy is significant. It can enhance mood, emotional well-being, improve the quality of sleep, better sexual function in both men and women. I mean, it's profound the effects that this can have, especially the additional benefits of, protecting your muscle strength, your bone density, your cardiovascular health. With that being said, though, it's never without any risks. Just like anything you put in your body, there's nothing without risks. There's a lot of studies that are kind of controversial regarding the risk for breast cancer. I will tell you that synthetic hormones are very increased risk for breast cancer. Bioidentical, the evidence is less clear than the synthetic, but ideally what it is a lot of your breast cancers are estrogen-based sensitive cancers. So you obviously have to do a very good history of a patient. They have to make sure if there's a significant family history of breast cancer, they need to know that risk and be very up to date on all of their screenings, which is true of any patient that's undergoing. I always make sure that they have had their colon screenings, their mammograms, their pap smears, and everything. Those need to be make sure to be in place before starting any of these type of therapies. There's also a theoretical risk of endometrial cancer, but it's more estrogen based on there, but we always use progesterone to protect that uterine lining. And as far as ovarian cancer, there's kind of like limited specific research on the effect of bioidentical hormone on that. But again, if something is an estrogen-based cancer and you're going to give them something, theoretically, that could make the potential worse. And for men, the relationship between testosterone therapy and prostate cancer, there's been a lot of conflicting studies again with that, but testosterone replacement therapy specifically does stimulate the growth of prostate cells. So if you had prostate cancer and you took testosterone therapy, that would make it worse. So you would obviously screen the patient for that, and they're screened before and during treatment. It's not that it's going to increase the cancer, but if you had one, then that could theoretically make that worse. So that's why it's really important that you always have regular monitoring and things like that. One of the other potential risks would be blood clots. Estrogen is known to influence blood clotting mechanisms. So if a patient has a history of blood clotting disorders, then you obviously wouldn't put them on estrogen. Somebody who smokes incessantly, smoking increases blood clotting risk anyway. That's an inherent risk of that. So if somebody was probably a really bad cardiac patient, they smoked even with that risk and had a family history of blood clots, this would not be somebody that you would put on therapy. So, just like anything else, there are inherent risks. This is why it's important to always discuss that with providers. Bioidentical hormone therapy is way safer than any synthetic therapy. So I always recommend that, people go with a bioidentical, with that. Another thing that we like to really link in there is integrating diet with the hormone replacement therapy. So a pill is never a fix-all. You have to make sure that you're supporting those hormone functions in your body, because the diet can have a very big impact on maintaining a hormonal balance. We need nutrients from food that directly affect our hormone production and regulation, that influences everything from our energy levels to our reproductive health. So poor dietary choices can affect our insulin sensitivity, cortisol level, and the overall production of our sex hormones. So that's one reason why I make sure in our clinic we kind of incorporate the fast metabolism diet, which is essentially just a structured, really healthy feeding. If somebody's not really into that, we just make sure that they're really using specific foods that boost metabolism. So the fast metabolism diet essentially does different phases that support specific parts of our hormones. Like in phase 1, we're trying to focus on carbs and fruit, and to kind of reduce stress and encourage the body to relax and nourish our adrenal glands. Then we go to phase 2, which is more proteins and veggies, and we unlock the fat and build muscle, which is crucial for hormonal imbalance. And in phase 3, which is usually like Friday, Saturday, Sunday, we actually bring healthy fats, veggies, fruits, and proteins in there. And we focus on unleashing the burn, stimulating hormones, and enhancing heart health. So, we use nutrient-based foods, healthy fats, phytoestrogens, and fiber, and then incorporate things like physical activity, stress management, because if you are super stressed, you're not sleeping, that's affecting your cortisol, that's affecting your hormones, that's affecting your weight. It's just going to affect your overall health. So my goal is to personally look at the person as a whole and see what we can get you from point A to Z. I want you to be at the optimal health that you can possibly be so that, you can enjoy life. And everything. So again, the benefits of bioidentical hormone replacement and a holistic approach to health can be huge. So, I really encourage if people have those symptoms to reach out to somebody that specifically is, educated in this specific realm and stuff. Make sure you have a really comprehensive evaluation. We do this, and we do a very comprehensive approach and really try to really get to the bottom of it. And if you're interested in this, you can always contact me at www.stellarcareclinic.com or 928-267-3532. Text me, call me anytime. I'm always willing to answer any questions so that we can kind of help you be the best version of you. And with that, I'll open it to questions.
I have a question.
Yes.
I've been told in the past that I can't take hormones because I have high blood pressure and I guess it could cause a stroke.
So your blood pressure needs to absolutely be controlled. I mean, the hormones itself, definitely not synthetic hormones, like your Premarin and some of those will absolutely increase blood pressure. But some of your progesterones and some of those could actually help with that cardiovascular health, depending on what the specific, do you know what defect was and what you were low in? Certain ones like DHEA, some of those, especially if you are replacing the mother hormone, can, increase theoretically, even testosterone can, but if somebody is really well managed and we're managing their overall health, then they are usually safe. Now, if somebody's had multiple heart attacks, they really seem to have a clotting issue going on, then that may be somebody that's not a good candidate for that. But I mean, that's one reason why it's so important to have a very comprehensive evaluation to make sure that it's safe for you.
Okay. I have another question. My daughter is 16 and just got diagnosed with polycystic ovarian syndrome. And I know you had mentioned that your hormone replacement helps with that.
Yeah, it's very difficult to redo those replacements on somebody that is that young. A lot of times what they do is throw them on birth control, but usually the polycystic ovarian disease is often due to estrogen dominance. Estrogen tells our body to grow things. That's why when you get estrogen dominant, you can be increased risk for cancer because it just tells our body to go grow this, grow that. And then so what happens, it's telling them to overproduce their follicles and they're producing all these extra cysts. A lot of those patients also can have endometriosis and things like that. And that's where some of the progesterone-based things can really kind of help with some of those levels. A lot more difficult in the pediatric population, especially at that age, because you want to make sure you get the birth control in there. A lot of times that's probably why if she's seen a gynecologist, they're recommending progesterone, like the Depo-Provera, they're recommending the progestin-only birth controls and things like that in order to reduce that estrogen out a little bit.
Oh, okay, thank you for that. I'm sorry, but I have to leave. I have another meeting, but thank you. Very informative.
Oh, okay. All
You're
right.
welcome.
Thanks for being here. Thanks for being
All
here.
right, all right, thank you.
Are there any other questions?
Yeah, I
I
have
know
a question. You said your insurance will cover like to go get your blood tested or whatever.
Yes, typically they'll cover the blood testing and stuff, which is why we offer it to do that through the insurance, even though we're cash based. I also have access to Access Labs, who does cash based labs for a lot cheaper than like your LabCorp, your Sonora. Because typically, if we code it right, the insurance will still cover the lab portion of it. So unless people have a huge deductible, which this day with insurance is common, then those people go the Access Lab approach because it's cheaper than, if their insurance says they have to meet a $3,000 deductible before they pay anything, then, that's going to be expensive out of pocket. So,
And And you have the labs in-house there, so you do that to get the labs
Yeah,
done?
I send the recs over, and you just go over to a LabCorp, Sonora, or the Access lab is done through LabCorp.
Well, thank you.
All right. Yeah, Morgan.
Yes, you said you work with compounding pharmacies.
Yes, I have multiple ones especially because a lot of them are based out of Florida. So when the hurricanes hit, they were kind of down for a while. So we definitely had some in their production and stuff, but I have some located in California, Texas. Yeah, all the only certified ones, some of the big ones and stuff on there.
I may be able to hook you up with someone I know who has 3 compound clinics here in the valley.
Oh, nice.
Yeah. So she might be a
Absolutely.
good referral.
Absolutely. I would appreciate that.
Glendale, Scottsdale, and Goodyear.
Carrie,
Yeah.
I got a comment. Can you basically just talk a little bit about testosterone cream for men as far as energy levels?
As far as
Is
that
that a
versus
safe,
injections or what's the specific
yeah,
question?
is that a safe thing to do? Like, if you're getting tired, you know what I mean? Is
Well,
testosterone,
you only
someone
want
told
to
me
go
it
ahead.
helps out.
Oh, it absolutely helps out, but you got to make sure that your levels are low. So the problem is when people want to treat it when they're, if you're under like say a level of 500 and stuff like that, then it's okay because optimal is more 7 to 100. But it's the problem is when people are saying, I just want to take it because I think it'll make me feel better, but their levels are 8, 900. They're in the normal range. They shouldn't be taking testosterone. So
Okay.
it is safe. I mean, we talked about some of the risks with the prostate, in men and stuff with that, but theoretically, even those studies were poorly done. So as long as you're being monitored, you're having your PSA levels done, you have to have like your CBCs and things checked because testosterone replacement can theoretically raise your hemoglobin and hematocrit. So you got to make sure you don't go too high with that because that can increase blood clot. I've only had that happen to one. They really wanted to continue it. They didn't want to do creams, do that less. Injections do it more. So, but they like the injection. So they donated blood and they're fine and their levels have been good since then. So, and stuff with that. So it's theoretically safe. It plays a huge factor because the fatigue, the decreased libido, all those things, it can really have a significant impact for men.
Oh, okay. All right. Does anyone else have questions? Cindy?
This is my medical room.
Oh, we can't hear you. Your audio is not working. Jerry, was Cindy, yeah, maybe adjust your audio setting. Carrie, can you repeat? How can people get in touch with you? What's the best way? Can they call you? Do
So
you have a website? Yeah.
So both. So the website, www.stellarcareclinic.com, there are links on there that even have more information, and it has a direct button where you can schedule a free consultation or just to talk. 928-267-3532. You can text me, call me. I can't answer right away because I'm talking to a patient. I will call you back. You can text me with questions. That's one of the things that's nice about the clinic. You have direct access to me. I will answer questions and do things. It's not a matter of waiting to have a medical assistant call you back. I will answer you directly, and my goal is
Oh,
to
perfect.
give excellent care, to have people feel like they have access to somebody, and to get people feeling better.
It's really nice that that's available, especially when you're not feeling good, to have to get in the car and drive to a doctor's appointment. You know what I mean? Here with you, you could just zoom in and yeah, key in.
So Cindy's actually put her question in the chat. It says, if you do not have insurance, how do they handle services?
So it's all cash pay. So essentially, it's tailored specifically, and hormones definitely vary a little bit and stuff with that. I mean, some of the price for testosterone therapy is pretty much straight, but for women, because we may compound everything from estrogen, progesterone, and DHEA all together, then it's based on the pricing that we get from the compounding pharmacy a little bit, but it's all cash pay based. So we try to keep it as affordable as possible, but these things are not covered by insurance anyway. So they're not covered for reimbursement when you're doing bioidentical, because I also do anti-aging therapy, everything from NAD, methylene blue, different things like that. These are all peptide therapies, growth hormone, like your Somorelin and things like that. These are all things not covered by insurance. So we can usually get away with checking the labs based on, symptoms and things like that and get that covered by insurance, but the other is not. So we try to keep it as affordable as possible for the patient.
Oh, great.
Then he says, thank you.
Yeah, thank you. Thank you. All right, I'm gonna turn off the recording. So thank you again for that presentation. Very, very informative. And for those of you that are viewing in, I would reach out to her. So thank you again, Carrie.